Good evening. Our top story tonight. Ontario's Premier says vaccines will not be mandatory for hospital workers.
And Doug Ford says he's concerned about staff shortages and the potential impact on patient care. Our coverage begins tonight with Sylvie Lenve. Sylvie, what do we know?
Health Minister Christine Elliott just recently said that there would be a significant job loss if they were to mandate vaccines for hospital workers, which in turn would negatively impact patients.
We had to really do a risk assessment, and we know that in British Columbia, for example, they've had to cancel some of their scheduled surgeries because they've got about 3,300 workers that are out on leave now and are being requested to have vaccinations. We don't want to have to cancel surgeries. In Ontario, we've been very fortunate that we've been able to keep those surgeries going, even though we still have thousands of people that are waiting for those surgeries for hip and knee replacements, which are painful for people, prevent some people from being able to work, cataract surgeries and so on. People have been waiting long enough.
I think that the minister and the government need to show the evidence, show the documentation, show how they got to this decision when it's the opposite decision from what was advised by the Ontario Hospital Association.
Or for families of a cancer patient in hospital or any other patient in hospital, because it's perfectly reasonable for them to expect that the person who's caring for their loved one, that person's been vaccinated. It's not just it's actually a deal breaker, I think, for most families. So it's really hard to understand. Their arguments are full of holes. They're like Swiss cheese. They're worse than Swiss cheese.
You know what? Everyone has a right to their own personal choice about what they put in their body. But at the same time, they have a responsibility to comply with the workplace requirements to ensure a safe workplace.
The Ontario Hospital Association has been urging the Premier to make vaccination mandatory. Hospitals in Hamilton, Burlington, Haldimand, Norfolk, Brant, and Niagara have already decided to make the shot mandatory with medical exemptions. But today, Health Minister Christine Elliott said some hospitals were coming to them with concerns about staffing shortages if there were a province-wide mandate. Ontario says that the high vaccination rate among hospital workers and frequent testing of those who aren't vaccinated is the reason only 5% of hospitals are in a COVID outbreak. Now, individual hospitals can still implement their own mandates if they wish. About 4% of staff at St. Joseph's Healthcare are unvaccinated, just under 8% at Hamilton Health Sciences, and about 7% of Niagara hospital workers are unvaccinated. Now, the government says that they're going to review this decision during the winter months, particularly because people are going to be spending more time indoors and COVID rates could rise. Back to you.